Good afternoon. This is Dr. Bill Bird, Chief Medical Officer at CGH Medical Center in Sterling, Illinois. Thank you for taking the time to watch our broadcast today. This week, as I've been doing for the last several, we're going to talk about COVID, and I'm going to do this in the format of some facts, some news, and then some analysis of all that. And of course, I'll answer any questions that you may have. I do have a few questions that have already come in that I'll get to as I get towards the end of this broadcast. And as always with the facts and news, sometimes they kind of blend together, but I'm going to try my best to kind of break them into two different categories. So first fact to share, the sobering one, which many of you have seen as well. In the last 3.5 months, the death toll from COVID has gone from 600 to 700,000 U.S. citizens. So it used to be 1 in 500. If we have 340 million people that live in the U.S., that's 1 in 485 people have passed away from COVID. Other facts that I wanted to share with you, some stuff from the CDC. As of October 1st, we were averaging 106,395 daily cases, which is down about 13.3%, which is the second consecutive week of declines. Keep in mind, of course, that as the South, particularly Florida and Texas, have gone down, it really pulls down the country's averages because at one point in time, Florida and Texas had 20% of the cases. So there are still pockets in different states, UP in Michigan, some places out in the upper Midwest also. And anyhow, you can look at a map. If you look at the New York Times map, it'll show you places where there's still some areas that are increasing in numbers, but by and large, the numbers are going down. Children from September 23rd to 30th represented 26.7% of cases. And in total of U.S. cases so far, people under the age of 18 are 16.2% of the cases. Other facts, hospitalizations are down 20% in the last 2 weeks. Remember what I said about Texas and Florida. Nationwide, as of October 4th, per the CDC, of all ages, 65% have had one dose, and 56% are fully vaccinated, and 3.1% have had a booster dose. And 18 plus year olds, 78% have had at least one vaccination, and 68% are fully vaccinated. Okay, yeah, in Illinois, cases are down about 14% in the past 14 days. So Illinois' numbers are headed in a good direction. Matt, I'm going to have you put up our usual graphics at this time as well. Thank you. So here's our weekly update, and this is the red bar is the cases in our county this week on the top left there, and then the blue bar is the previous week. And this is the second week in a row where the red bar has been smaller than the blue bar. So I like it when the red bar is smaller than the blue bar. And you look at the 2 weeks prior on the bottom left there, and headed in the right direction there as well. You can see on the bottom right the number of cases, kind of the spikes, and it has the look like the spike numbers are starting to go down in our county, which fits the red and blue bars. So that's good to see. What else do we have, Matt? Yeah, so this kind of just shows what we've been telling you, is that September really had a spike in terms of COVID cases here in Whiteside County. You can see the yellow September, red is August, and blue is July. Looking forward to July numbers at some point in time again, that's for sure. What else did we want to show our viewers, Matt? Yes. So this was yesterday's update from the Illinois Department of Public Health. So we still had 3,058 new confirmed cases with 24 deaths. 1,700 people in the hospital with COVID, which is going down. 408 in the ICU and 233 were on ventilators, all of which are improving. Positivity rate is 2.6%, which is also improving. Vaccines administered is 30,000, which I think is about the same as last week. I think part of that 30,000 are boosters. And then, of course, then the IDPH, 64.3% of adult Illinoisans have been fully vaccinated, and 81.7% of it had at least one vaccine dose. And then that's just the other ones, just the U.S. numbers. Okay, what else did we want to show our viewers, Matt? Not that one. There we go. So just as today, it's happening as I speak. There is a booster clinic going on, jointly run by the health department and CGH at McCormick Event Center. Actually, don't leave because you have to leave the video. No, I'm just kidding. You have, looks like about 50 minutes to get there because it's happening during that period of time. But fear not. Thanks, Matt. But fear not. If you plug in, get a COVID booster vaccine, you're going to see that multiple retail pharmacies in the area, you can get that as well. Now, granted, this is just for Pfizer right now. Others are going to be coming soon, I would think. But anyhow, in terms of the Pfizer booster, you can get that at retail pharmacies as well. All right, let me transition now to news. So it's looking like the FDA panel is going to review the possibility of doing boosters for Moderna and J&J on October 14th and 15th. And they're going to be reviewing the possibility of giving a vaccine to 5 to 11-year-olds on October 26th. And as we've talked about, Pfizer boosters the wording is, if you're over 65, you should. If you're 50 plus and have some high-risk health conditions, you should. If you are a healthcare worker, teacher, food service, those type of things, like grocery store and those kind of, the wording was you may get a booster. So those are just so I think most of you know that, but just as a reminder, we are doing here at the hospital a flu drive-through clinic on Saturday at the main clinic parking lot area. So you just drive your car and drive through and get your flu your flu shot, and that'll be from 8 to 11 a.m. Other piece of news, just as for those of you who watch this on a regular basis. So next week I have a special guest who's going to host the show, and that's Dr. Eric Coons. Eric is active on Facebook and posts and those type of things, and he's hosted this before, and he's going to be hosting the show next week as I will not be available to do it. So another piece of news that came out from the CDC. So they did a study of anxiety and depression, and saw that definitely increased and peaked during surges. And I'm certain that is happening with a Delta surge as well. There is an article came out in JAMA, which is the Journal of American Medical Association. It's one of those journals that we in medicine, it's one of those top tier journals that we follow. Anyhow, the article was a review of convalescent plasma. I don't know if you remember that, but when the pandemic started, that was a big push, is to get convalescent plasma. People who have had COVID, get some of their blood and then give that to people who currently had COVID and were really sick. Unfortunately, it's looking like that the convalescent plasma is not helpful to take care of critically ill patients with COVID. So it's one of those things that we thought made sense it would help, but as research is going forward, it's looking less and less like that is the case. Another article in a journal called Cardiovascular Diabetology talked about what they were seeing in patients who have long COVID, and trying to explain what causes long COVID, is that they're seeing microclots in these patients, and trapped within those clots are inflammatory molecules. So, and the speculation is those combination of clots and inflammatory molecules cause many of the symptoms that people that continue to have COVID symptoms well after the viral shedding has occurred are happening in those patients. In the New York Times, another piece of news, there's an article that AstraZeneca is seeking approval from the FDA for a long-acting monoclonal antibody treatment for emergency use. This is for high-risk patients. So, we are giving monoclonal antibody treatments to patients who have symptomatic COVID, who aren't hospitalized or who are at high risk and been exposed to someone with COVID. So we've been doing that for quite a while. This is a product that, from my understanding, those antibodies that are manufactured by the company stay in your body for a longer period of time to fight off potential infection. So we'll see how that all plays out. Now these mandates are beginning to kick in. I saw in New York State, there's a hospital called Northwell Health, which it's the biggest hospital employer in the state of New York, and they employ about 76,000 people. And just came out today that about 1,400 of their employees either resigned or have been terminated because they did not get vaccinated. More news. What else do I want to share with you? Oh, yeah. So I saw something that was a joint thing that came out from the FDA, CDC, and Infectious Disease Society of America. That's our infectious disease doctors have their own society. And what came out from that is that they said that antibody tests are not helpful predictors of immunity status just in general. So let's say someone does an antibody test to see, do I have antibodies, and does the number of antibodies mean that I should be immune? I have enough antibodies. And so far, at least, that is not working out to be a helpful predictor of whether or not someone's going to get sick, because that has come up in that with the mandates that are beginning to roll out. Folks are saying, hey, I have antibodies, and therefore I should, I shouldn't have to get a vaccine. And this information is saying, not so sure about that. Now, it doesn't mean that those antibody tests aren't helpful. If someone basically for folks who you're wondering, did they have any sort of immune response at all to the vaccine? What I'm reading is that, like, someone who's immunocompromised, or someone who's who's on certain kinds of chemotherapy, or someone is in a nursing home who wouldn't necessarily, they're old enough that you wonder, did they even have a good reaction to the vaccine? Those tests can be helpful to get a sense of whether their body responded at all to the vaccine. And the other thing that can be helpful if someone has long COVID and they didn't do a PCR, it seems like they have long COVID. Their symptoms would suggest they have long COVID, but they didn't ever get a PCR test to confirm that. This antibody test can be helpful to say, oh yeah, okay, at some point in time, this person had an infection. So I thought that was interesting news to share with you. Sobering news. This was out through something called Morning Consult. So it's a little lower tier in terms of information than I pull out from, but whether the number's completely accurate or not, it says that 18% of healthcare workers have quit their jobs since February of 2020. Ooh, that's a big chunk. And we feel that across the country in terms of hospitals and staffing and trying to have enough staff to take good care of patients. So whether it's 18% or not, it's reality that in some way, shape, or form that has occurred. Florida Hospital Association predicts by 2035 that they're going to have lost close to 60,000 nurses in the state of Florida, and they say that 1 in 3 clinical nurses have left their positions in the past year in Florida. Now, whether those numbers are completely accurate or not, the trends are very real in terms of what's going on, which are concerning. Yeah, another piece of news was an article I saw. This was a clinical infectious disease journal, and also a publication called BioRxiv. And basically, they did study on the alpha variant, which was the variant that was causing infections prior to this Delta one. And what they're seeing is that particular variant, and they speculate the Delta one as well, the small particles in there are spread about 43 times more easily in the air than the previous infections, which is they speculate is one of the reasons why those infections, those variants have caused a flare of infections. And along with that, they make the comment that masks do cause a significant but modest source control. In other words, prevention of the illness. Now, for instance, in Bangladesh, they did a study, and folks who were wearing surgical masks on a regular basis reduced their risk of, I believe, symptoms are, I'm not sure, getting sick or just symptomatic, but 11%, and cloth masks by 5%. So not perfect, but if everyone's doing it, it helps to pull down that risk. And what else did I want to say about? Yeah, and they also just said until vaccination rates, or I guess you could also say a natural immunity, people get enough, get sick, get the infection, there's going to be a need to continue with some of the masking and trying to keep yourself distance and those type of things. Other news, and I'm almost done with the news. So Pfizer is going to, like I talked about, it's going to get sending information to the FDA about immunizing children. Of note on that news, they mentioned that about 30,000 children were hospitalized in August. So, a very small percentage of children die, although they do. But that's a lot of disease. That's a lot of suffering. If this vaccine is safe for kids, that would be helpful with that. Final piece of news. Well, actually, I already shared that piece of news. So that's facts. That's news. I am going to transition into some analysis, opinion questions. And here's one of our viewers, Steve, sent me a few questions that he wanted me to take a shot at, and I'll try, Steve. So here's the first one. Why is Whiteside County still less than 50% fully vaccinated for COVID shots versus, say, Joe Davies, which is about 20% higher? And he shows some percentages. Yeah, really interesting question. I'm going to take a shot at it, but I'm telling you right now that I'm just throwing out some ideas. This is not the official, for sure, answer to this, but I think I would flip the question. And I looked at the New York Times has their map of vaccination rates in counties throughout the country. And really, Joe Davies is an outlier. And they have a pretty small county. So it doesn't take a whole lot of people who agree and decide that vaccines are good for them to pop up in terms of their numbers. But really, if you look at the rest of the state of Illinois, other than Chicago, the Chicago area, which is a high vaccination rate, and then bigger city areas like Peoria County, Champaign County, Sangamon County, which is where Springfield is at, the rest of the counties don't have in the rural areas, their vaccination rates are pretty similar, or most of them are pretty similar. And even in some of the southern and like southern counties that border Indiana and Missouri are actually lower percentage wise than even our percentage here in Whiteside County. So we're not that atypical for rural counties in the state of Illinois. And why do rural counties have lower vaccination rates than more populous counties? I think we've all read theories on that. Obviously, there does tend to be some correlation with some political type of leanings in terms of those vaccination rates when you compare cities versus rural areas. I don't think it's access to the vaccines, because we have pretty good access to those, very good access to those, at least here in this county, and I suspect in others as well. So that's my best shot at that, Steve. And I would throw up one other thing that I mentioned this last week, And they're just speaking about vaccines. And for those who still have some concerns about getting a vaccine, maybe even have concerns about going and getting a booster, even if you already have had 2 vaccines, there's a video out by something called MedCram that we have a link to on our Facebook page and our website. And it's a long video. It's 2 hours and 25 minutes. I've watched it. It's excellent. And I strongly encourage you to, take the time to, if you really have an interest in that, and I think it'd be helpful not just for you, but perhaps for the folks that you have a chance to interact with. It answers 10 really common questions that I have heard, concerns that folks have about going forward with vaccination. And does a really, obviously it's detailed, but a really nice job of answering those questions. So MedCram is the video, and we're going to have a link to that on our Facebook page and a link to that on our website. And if you're so inclined, I think that would be really helpful. Okay, second question that was asked of me pre going live here is, what is the progression of the COVID infection and how does COVID kill you? So first of all, once again, thanks, Steve, for that question. It's a really interesting, it's interesting in the sense that, the pathology of all this for someone who likes science is interesting. It's sad that this happens to people. Make no mistake about it. But we're going to put up the link of what I thought was a really helpful article that I found about this from a company called the Advisory Board from April 13th, 2021. And so basically what's going on with COVID is you have this virus and it gets into typically your nasal passageways. And there are certain receptors that they attach to called the ACE2 receptors, which, by the way, is why there was speculation early on that some high blood pressure medications like lisinopril, losartan, you may be familiar with, which are ACE and ARB inhibitors, might be helpful in terms of COVID. I don't think that's played out very well in terms of being actually the case. But nonetheless, the virus gets in through these receptors. And then there's this tug of war as the virus begins to get access to cells and begins to replicate. And this dance between that replication and the cell destruction that's occurring along with our immune system. And I'm not going to claim to be an immunologist and have all the answers to this, but the real fascinating part of this is that for some people, their immune systems do a nice job with that. And they don't have any symptoms at all with their COVID infection, or they have very mild symptoms. And so as there's this immediate response where some chemical agents that go in and begin to fight that viral particle begin to work. And then, of course, antibodies and those kind of things come into play. Some people's immune systems work nicely with that, and some people's immune systems get overwhelmed with the virus. And then this cascade where the virus is overwhelming the systems, and at the same time, the immune system is, in a sense, over-responding and overstimulated and begins to almost attack itself. And particularly in our lungs, the combination of those two things begins to cause problems with oxygenation, because you have cells die and you have debris, you have this immune response, which is causing inflammation, and all of that affects the ability for the air that we take in, which has 21% oxygen in it, to get across the alveoli, which are the little bitty little pockets in our lungs, and we have millions of them in our lungs, and get across that thin lining into our bloodstream. And all that debris really makes that difficult to happen if someone has a severe case of COVID infection. And then, of course, that infection can spread to other parts of our bodies as well, as the heart, brain, kidneys, other places. It causes clots because of what's going on with this immune response and the inflammation as well. So it's a cascade of events. And the thing that we know too is the viral replication, let's say in general, is done by 10 to 14 days. That's why we typically have folks only isolate for 10 days, because for the vast majority of people, that viral replication is ended. But as you know, people who have COVID, they keep getting sicker even after that's ended. So this whole immune inflammatory response just struggles to shut down at some point in time. And it's another reason why dexamethasone is probably oxygen and dexamethasone are like, yeah, that helps people who have COVID. There's no question about it. And dexamethasone is an anti-inflammatory drug. So it helps with inflammation. And we think that's why it's helping for people who have COVID infections. So other thoughts on that is that, a lot of viruses, their goal is really their goal is to replicate from a natural selection evolutionary standpoint. A virus's goal is to replicate and they want to make more and more of themselves. The virulence, or the fact that it gets us really, really sick and we can die from it, is kind of just a byproduct of that. So just keep that in mind when you think about these viral infections. A lot of viral infections that we have are just quiet in our bodies. A lot of people have what's called CMV, or cytomegalovirus, and it doesn't cause any symptoms, but our immune systems are, in a sense, dancing with that virus and keeping it from becoming something that bothers us. And granted, cytomegalovirus has been with us for a long, long time, and this virus is new to us. So it takes some time for us as humans, collectively, not just us as individuals, but collectively, for our immune systems to become acclimated to this virus. There's a book that I recommend, which is really helpful in terms of thinking about pandemics. And it talks about more than pandemics, but it definitely has pandemics in that book and how that has affected societies since the onset of human civilization, around 10,000 years or so ago. And it talks about this, and these pandemics have been around for a long, long time. And that book, Guns, Germs, and Steel, does a really nice job of talking about that. I think the book came out like in the late 90s, but it's still very relevant today. Okay, a third question that came up, once again from Steve. Thanks, Steve. What's the goal of vaccines? Eliminate disease or just minimize symptoms, deaths, or other impacts to society? Once again, really good question. And my answer, unfortunately, is not going to be black and white. I think it depends. So it depends on who you ask, and it depends on the virus. So if first of all, if you ask individuals, I think their response is going to range anywhere from, hey, just let it happen and I'll deal with it, to I don't want to get sick at all, right? So that's at the individual level. At a population health level, I think that is where you start talking of population health starts, and hospitals and medical folks as well start talking about, okay, well, what kind of virus are we talking here? And that has a bearing on what your goal is too. So for instance, polio and smallpox. Smallpox was eradicated. I think the last case was in 1977, and it had killed, oh my gosh, how many millions of people over the course of 200 years or so. It was around in the Revolutionary War, but it was eradicated in 1970, officially in 1978, if I remember right. And that virus, and the same for like polio, it's almost eradicated. Just little pockets that are of the world where they'll have to go in there and try and give vaccines to tamp it down, if I remember right. But both of those viruses, from what I remember of them, they don't mutate quite as easily or as quickly. So the vaccine covers a broader range of mutations. I'm not particularly sure in the science behind either one of those variables, but yeah. So those viruses, hey, we want to eliminate them. You think about shingles, another virus. You get the shot to reduce your risk of getting shingles, because no one wants to get it's by and large something that's not going to kill you, but boy, it's really uncomfortable and it can make people really miserable. So it's a vaccine, and the goal of that vaccine is to reduce the risk of getting sick and reduce the suffering that comes from shingles, reduce the severity of the case, and then COVID, which is a relatively new one, right? And so we know that, yeah, sure. I mean, the booster that we're getting, that you have access to, I think you're gonna, if you've had any of the main shots, I think pretty likely here, I'd be surprised if Moderna and J&J aren't also approved. If you get a booster, it probably, not for sure, but probably moves you more into towards that camp of just not getting sick at all. And, for individuals, that can be nice because you're not having to take time off of work. You're not having, if you have children, for those of you who have gone through the process of having to either isolate because you've had COVID and then whoever's with you has to quarantine and that whole time frame, boy, it's sure nice to not have to think about doing that. Definitely from a public health and hospital standpoint, having the vaccine available to, if we didn't have the vaccine, the number of hospitalizations and deaths that would have occurred in the last year and a half plus are much higher than we've had with the vaccines. So from that standpoint, the COVID vaccine has been very helpful in that regard. Another benefit of the vaccine is that it also, it buys more time. Granted, you can go down the path of natural immunity, and it's an option. It's just not a really good one from my perspective because, let's say 1% of people who get the infection, particularly as you get older in age, that get that infection don't do well. And 1% doesn't sound like much, but if you're talking hundreds and thousands and millions of people, that's when you add up and you have over 700,000 people that have died of COVID. So yeah, I mean, the vaccine is very helpful in terms of giving time for new treatments to be developed, and even in a sense for us as humans I talked about our body's immune systems to kind of get more acclimated to this infection. It gives some time for that as well. It almost, in a sense, gives the virus more time to become, as variants occur, to become more cold-like, if you will. And because some of these there's like, I think 4 of the coronavirus variants that circulate around that cause colds. Okay, that's something people deal with all the time. So anyhow, I think that's interesting. And the fourth question, but it's a good question, and I like I said, I think the answer is multi-layered. And the fourth question was, with the increased number of breakthrough cases, how does that impact herd immunity theory and percent needed to be vaccinated? Yeah, another good question. And I think we've talked about this a bit before, but it definitely changes the equation, and the number needs to go up. Matt, would you show our graph that we show regarding that? So yeah, natural immunity are people that have had the infection. And even in this case, with the Delta variant, some people who have had the Alpha variant or other variants are still getting sick from the Delta, although it seems not quite as sick because they've already had some natural immunity. And then, of course, people who are vaccinated for COVID, even if they get Delta, tend to not get as sick or sick, and they tend not to be hospitalized or die as easily. So that's a positive part. And then you look down below and you still have these variants that continue to happen and will continue to happen. And how we go about our lives and our behavior, which has an impact on spread as well. So yeah, with the Delta variant, because we know it is, thanks, Matt, because we know it spreads easier, because that's what we know viruses naturally, in terms of the ones that are selected out and do best are the ones that can attach to hosts and spread. And so, yeah, this Delta one is a really nice job of spreading. And so the more people that are vaccinated in particular, the harder it is for it to spread. But make no mistake about it, because there are breakthrough infections, the need for more and more people to get vaccinated to kind of stymie that growth is there. And I don't know what the number is, but it is a higher number as a result of this Delta variant. And yes, people who have had the natural infection and have now recovered from it, they also added the pool of people who helped to keep that spread from occurring. Okay, I'm at 12:35. I try to. Oh, let me see, Marianne. So flu shots. Yeah, you right now flu shots are going to be. I would guess health department has them, and then retail pharmacies have them. We are right now just at the hospital starting to get those in, and so we will start pushing those out to offices here in the next month. But our offices do not have them right now, but they will, Marianne, at least for CGH, and I would suspect for other doctors' offices in the area and across the country. Mary, nope, we do not have vaccine mandates. We do follow what the governor of the state of Illinois, Governor Pritzker, has asked and mandated, and that is you're either vaccinated or you're tested every week. So that is occurring for our employees. And then, as you know, the president has made a statement about healthcare workers who receive government payments, Medicare, Medicaid payments, that they're going to need to be mandated to be vaccinated. Details of that are still not out yet. So if the government says that has to happen, then we will follow through on that as well. But that's kind of where we're at with things. Yeah, how soon after having COVID can you get the flu shot? That's a good question, Christy. I know that there's no issues with if you haven't had the infection or if you've had the infection in the distant past, that you can get a flu shot and a COVID shot at the same time or separate times, but they can be the next one day and then the next day. And however, if you've recently had the infection, and I'm defining recently as within the last, let's say, 90 days, I don't have an answer for you. I don't. I would recommend, first of all, our gang will, Dr. Coons is going to be talking next week, and we'll definitely I'll relay that to him to see if he can find that out. And for you, Christy, I think the health department would be someone that I would definitely lean on. But we will also I'll check with our infectious disease folks to see if we have any kind of answers. If I do find one, we'll post it. But as always, if I don't have an answer, I'm just going to say I don't. And right now I don't. But that is a really good question. Any other questions? Well, hey, thank you for taking the time to watch in and tune in to this Facebook Live presentation. We will continue to do these throughout the course of this pandemic until Dr. Coons shows up and talks and has a conversation with you next week. Thank you for listening, but also have a great week. Have a safe week. And do things that you find make you smile, and try to keep away from things that make you sad and make you frown. Until next week, thank you very much. Bye.